The NHI is the South African label for what is commonly called universal health coverage.
The idea is to create a single financing mechanism that purchases healthcare services from public and private providers towards broader population health.
Everybody, irrespective of your class, irrespective of your economic status, can get access to healthcare. So basically, government becomes the sole service provider of healthcare.
80% of the population, or the poorest of the poor, access the clinic as their first point of access. And I think if we want to build the system really, really well, we have to make sure that at first contact with the health system is a good contact.
Everybody will be registered into one fund, and everybody will then access their healthcare through this fund. And your first point of reference is through the primary healthcare.
If you are contracted into the NHI, you'll be held up to a universal standard. Your practice will be audited. You will have to comply with certain regulations. You'll have to contract in, so they will give you the rates that you're allowed to charge, and they'll pre-negotiate all of that. Medical aids are not going to disappear. The Act states that there will be room for medical or private medical funding, but that will only be to cover procedures or services that are not available within the NHI.
The space for medical aids is in complementary cover. So the complementary cover is essentially that cover that's not covered within that comprehensive scheme. And I think the medical aid industry are very good at developing financial products. And I'm sure they'll be able to figure out a way to keep that profitable for them.
We've got a small amount of funds allocated to the public sector, but we have an ever-increasing population for that public sector to cater for. You've got some provinces that only have 6 or 7 gynecologists for the entire province public sector. Those facilities are going to be strained, those equipment are going to get damaged because they're not designed for 1 million pregnancies to be handled by that infrastructure.
Government is going to also start purchasing healthcare infrastructure from private healthcare, right? So it's not only going to be the public health sector providing the service. We're going to see hospitals, private hospitals, also providing healthcare for everyone.
So once we start to decentralize the need for people to flock to public sector facilities, you should be able to more equitably spread those resources and upgrade those facilities.
How health funding works in the public sector at the moment is that money get nationally raised revenue through taxes and the like, right, are distributed through the various government competencies, and health, for instance, would get roughly around 16% of the budget, 12% of the budget, right? And that budget will then be split between national and provincial entities, right? So nationally, they would get like 50 odd billion, and then the provinces would get around 180 billion distributed through them through an equitable share.
The issue in South Africa is our predisposition to fraud and corruption. Unfortunately, that's always going to be at the back of any patient or any civilian's mind. We've seen what has happened to other state-owned entities. Is that going to happen to NHI?
If you look at the bill, it's more around the governance, right, of the NHI, right, where the funds are going to go. The funds are going to go into an NHI fund, how they're going to be administered, and I think that's where the concerns are.
In the public sector, we have a trust issue around level of care, right? So people that should be going to primary healthcare clinics are going to hospitals because they don't trust that the primary healthcare center will be able to meet their needs, even though their health need is better served at a primary healthcare center. So in order for our referral pathway to work, we have to start building trust in the system.
What we need to understand is that it's going to take time, but also we maybe need to actually, civil society organizations need to provide those answers around how to be prevented from being captured by private sector or even corruption.
If we can get the funding correctly implemented, if we can get the finances ring-fenced so that there is no corruption and no mismanagement, the rest of the system will work very, very well.